Bismillahirrahmanirrahim. This is subject of child development and lecture number 19. Today our topic is social characteristics and needs of a child. The outlines of the lectures are introduction, then child and family, needs of child and family, special needs of children, meeting the needs of children, and then explanation. First of all, introduction to the child and family. Suppose we give a name Jamie, like if he is a 3-year-old boy. When his family moved to Canada, he was diagnosed with autism at 21 months old. His parents could not accept this fact that his mom spent most of the time crying and feeling depressed. His father also didn't want to talk about it. His mother was always busy making appointments on the phone and talking him to the hospitals. So his older brother thought that Jamie was dying because they were spending so much time at the hospital. So after Jamie's diagnosis as autism, his family's daily life has changed. So this is one of the event that I have explained. So we will discuss it at the later stage, that how it affects on a child and what are the effects on a family. What are the needs of the child? Now here, as we have studied earlier, that Jamie is profoundly autistic and was diagnosed that at 21 months old. This would affect his overall development, such as language, social, emotional, cognitive, and physical development. Thus, Jamie needs appropriate education and intervention programs within the inclusive environment. So remember that during this age, when the child is not given the love of the parents, their company, and the company of their family, including his father, sisters, brothers, then he may face the problems in language, he may face the social problems, he may have the emotional problems, he may do not get the cognitive abilities, and also the physical development as itself. So all these things which may be lacking during his development. So there are some needs of family. So what are the needs of family? Like Jamie family is new to Canada and Jamie was diagnosed with autism. When considering this situation, his family needs multiple services because his family is always remains busy and to the life schedules. So there is a need of different things to the Jamie. So that's why they need multiple services like settlement services, counseling services, consultations with the specialist. So all these problems definitely they are the need of that family because they don't know that how to settle his son or how to settle their family members, and they don't know. That's why they need counseling services also, and they have to consult with some specialist in this regard. Then Jamie's special needs are also there. Like Jamie is profoundly autistic and was diagnosed at 21 months old. Then here we have used the term autism. What is autism? According to the reading package, autism is the result of neurological disorder that affects the function of the brain. and often appears relatively typical in their development under the age of 24 to 30 months. So this is the problem that remains with the child if they don't get uh, the proper attentions of their parents or their family. So their brain may get the neurological disorders, and that may affect the function of the brain, and also that reflect typically on their development. Then delays in language, play, or social interactions, because most of the time when he remains silent, so definitely their language problems may be there. And if there is no play, and if they have no chance to play something in home or outside the home, then he may face such type of problems. And when they don't interact with their children, and definitely there will be a problem of social relations also. So that disorders is a combination of several developmental challenges, because at a time the development of the many things that those are happening at a time with the child. So these problems may be there with the child, and with that person or with that individual which who are facing the solitude behavior. Then common traits of autism. What are the common traits? Like impaired communication, means lack of language skills. Gestures are used on behalf of words, and repeating spoken language is present. Then the second problem that may be a problem with the social relationships and play skills, like lack of eye contact. If you don't mix up with the people, then there may be the problem of eye contact with the people, and maybe the short attention span, and difficulties in making friends and interacting with others. Engagements in stereotypical or repetitive behaviors, and this is showing an obsessive interest in a single item such as train, and showing difficulty with changes in routine. Then sensory impairment. Sensory impairment means that sensitivities to sensory stimulations such as sight, hearing, touch, smell, and taste. So these are the sensory impairment that a child may face during the disorder of being autism. Then what are the causes of autism? Because when any individuals face some disorder, or if he or she face some diseases, so definitely there may be some causes behind that. And what are the causes of autism? So the causes of autism are associated with genetic, environmental, and parental factors. According to the reading package, although a single specific cause of autism is not known, currently the current research links autism to biological or neurological differences in the brain. So there is a genetic basis to the disorder, and probably involves several genes in combination. Also, there are some other factors that may cause autism, such as environmental toxins, for example, heavy metal such as mercury and air pollutions. Parental environment such as advanced age in either parents, taking psychiatric drugs during pregnancy. Then introduction to the individual special needs. The children also get special needs during certain stage. That 4 different types of autism spectrum disorders are there. Like there are 4 different types of autism spectrum disorders, and what are those? The autism, and pervasive development disorder, Asperger's syndrome, and childhood disintegrative disorder. Then some other needs are like autisms, Language in autism, language develops slowly, and the child may face difficulties in communicating with other people. Sensitive to sensory stimulations such as hearing, sight, touch, smell, and taste. Lack of eye contact may also be in autism. More common in boys. This is normally autism disorder remains in boys. In pervasive development disorders, how the children feel or have disorders like commonly referred to as atypical autism, severe impairment in specified behavior, and in childhood disintegrative disorders, this is characterized by normal development for at least the first 2 years, followed by the significant loss of previously acquired skills. Then Asperger's syndromes, the common characteristics to autism and difficulties in social interactions. Lack of communication skills may be there in Asperger's syndromes, and little impairment in language and cognitive skills. More common in boys also. Then diagnosis of autism. If we face some problems by the students or by the children, and if they are facing autisms, so what are its diagnoses? So actually there is no medical test for diagnosing autism. So diagnosis of autism is based on the observations of the individual's behavior and communication, and this is the duty of parents that if they do not communicate, or they do not they do not spend their time with their children, so they can't be able to observe the individual's behavior. Also, it should be evaluated by multidisciplinary teams such as neurologist, pathologist, psychologist, and developmental pediatricians, and speech language pathologist. Now, the JEMI special needs. Based on all information about autism, JEMI might be displaying lack of language skills, difficulty in playing with friends, short attention span, lack of spontaneous play, and social interactions with others. So therefore, it is important to understand the characteristics of autism and provide appropriate education and intervention programs in the child care center as soon as possible. By providing an effective learning environment, he can improve not only his communication skills but also social relationships with peers through play, activities, and appropriate materials. So these are the special needs of JB that due to the parents not attending to him, so he may face such type of problems into his life. Now, meeting the needs in the child care centers. Modification of physical environment. Here we can observe that this is a physical environment for the children, that we must create such environment where a child may get every type of feelings, like feeling of study, feeling of taking foods, and so on, or spending as leisure time. So whatever the needs of the children are there, so we must provide such type of environment to the children. So we must modify the physical environments for the individuals. Then like materials, toys, and equipments. So it is important to provide Jimmy's with a variety of materials, because he will show an obsessive interest in a single item such as car, and by providing new and exciting materials, he can have interest in other toys. So also by displaying them within his eye level, so he can see them easily, and it will be easy to access. And then classroom labels. A labeling system will provide Jamie with information about where to find items without other people's help. So it will allow him to know about where tie needs to be put away. So this will allow him to have more independence in accessing toys and material. So stability and predictability. It is important to provide James with a stable and predictable schedule because he has difficult time in changing routines. So by posting daily routine schedules with time and pictures on the wall, he can easily see it and predict the daily routine. Then involvement of typical children. So it is critical to provide Jamie with opportunities to participate in cooperative play because he has difficulties with interacting with others. So by providing him with opportunities to participate in cooperative play through tie and activities, so he can learn how to play with others and take turns, which will develop his social skills. Also, by listening to other conversations, he can develop his language skills. Then, in collaborative planning, when planning a curriculum for Jamie, it is important to include his parents and other teachers by sharing ideas about his strengths and weaknesses together. So we can have more ideas to improve his needs and co-plan in a productive way. Then parents of children with special needs. It is important to provide meetings for Jamie families so that they can feel free to come to the child care centers to meet with staff, also by providing resources and information that they can get accurate and updated information about Jamie's special needs. So parents must visit to the child care centers where their childs are being kept for providing the special needs. So if they need some special needs, so parents must know that what are the special needs and they must inform to the staff and also the resource persons. Giving instructions. Before giving instructions, it is important to give Jamie a warning so he can prepare for the next step. So this is because that he has difficulty in changing routines. Like I will give him instructions using simple language with visual strategies such as photographs. Then I will say it once, then give him time to think about it. Then teaching strategies reinforcement. Like if the student doesn't learn, then there are some reinforcement strategies that due to which the children may be given the more opportunities for learning. Like when Jimmy's demonstrated his social skills such as taking turn and lining up, so I will reinforce the behavior by praising him, smiling and providing him with his favorite activities. So I will also reinforce his social skills by providing him with a favorite toy. So this is what that those things due to which the child may get his interactions. So we can have we can provide them their special needs. So then, but while meeting the needs in the child care centers, there are some teaching strategies like using visuals to increase Jamie's comprehensions, and I want him to do. I will use visual like photos, gestures, and objects. And by using different types visuals, he will pay more attention, listen to my instructions carefully, and think about it. So this process will develop his cognitive skills and expand his attention span. Then in visual prompt, to improve Jamie's language skills, I will use a visual prompt. Then this will help him perform the correct response. For example, I will place the colorful card with words in front of him and ask him where is the car. So if he picks up the car, I will ask him again, what is this? So by encouraging him to answer the questions, he will improve his language skills. So then modeling and demonstrations. Like I will encourage Jamie's social skills by modeling and demonstrating skills or actions. I will show him how to share ties and take turns to actively participating during playtime. So, if he demonstrates social skills, I will also reinforce his behaviors by praising him. Then, in task analysis, this is very important to teach children, or like if we are studying the Jamie, then about defined rules and routines such as washing hands. Then I will break down the complex skills into smaller steps based on his abilities, so that he can perform. So he can also learn language skills through his process, like water on, hands wet, rub hands with soap, rinse, then water off, then dry. And inclusion of other children. This is also important, that for meeting the needs of the children in special childcare centers, so we must include the other children also. So it is important to provide Jamie with a variety of activities that he can participate in with other children. So this will allow him to have a lot of opportunities to develop not only his social skills but also his language skills by playing with his peers and listening to his peers' conversations. So it will also help him expand his attention span. Then inclusion of family. This is also very important, that if I say that I will invite Jamie's parents to the school to observe and interact with Jamie, so that they know about his strengths and weaknesses. So based on this, they can share information with me to improve Jamie's need. So it will also allow them to feel like more included in the program. So this is all about this lecture. Take care. Allah Hafiz.